oh yeah, that bugs me a little bit, and then she plants. She goes, oh, I can feel that a little bit too. But if she says it's here, it's because you're putting the tissue on stretch. And then you can do your resistive test. Hold your foot there. Don't let it push you down. That's going to bug her if it's tibialis anterior. Tibialis posterior. Oh, hang on a second. She might have a little bit of pain when she puts it on stretch. It might hurt when she points. But your isolate tib post, have her point, invert, and try to resist that. So I'm going to try to pull her out and up at the same time, and that's going to isolate your tibialis posterior. And their pain's going to be in back here. Tib post pain's here, tib ant pain's here. Okay, so you figure that out. So let's just stand up for me. It's pretty easy to find. Right? Hear it? Nothing? Okay. Pretty easy to find the shin bone. Shin bone is only about, what is that, centimeter, 2 centimeters wide. Okay. So those are your two edges. Tibialis posterior pain is back here. Tibialis anterior pain is up here. Anchor, tib post. Edge of my shin bone, just the other side of it. Overlap the last piece by half. This is where it gets critical. A lot of the time you don't know what the heck you're doing in the back, but just keep your tape running really straight and true. It's going to spiral up the leg a teeny bit as you go around, that's okay. So depending on how high your anchor is, how much pain, how much you want your bone. Okay, my anchor is going to be right on that bone. I don't want to go much higher than where the calf starts to get wide, so I'm probably going to come up to about there on her. So I'm almost in the same spot. One thing I forgot over there, top to bottom, or bottom to top is the way to go on these guys, right? Okay, tibialis anterior, come around. I want to pull the anterior muscle back onto the bone. So this time I'm going what direction? I'm going medial to lateral. Around and you'll feel soft tissue, and then you'll feel a little edge of something, and you'll feel a little edge. Again, if your tape pushes can be kind of deadly. Sometimes it's hard to find the medial border, but you'll find the edge of the tendon. And again, the tendon is not very wide. Okay? So hopefully their pain is down in here. So let's everybody have their pain down here at the tibial tuberosity. So I need to put my brace up higher. Okay? So what I do is I try to find, if I run my hands across the knee, okay, if I come in like this in my hand, I get to this point where it feels like I can just kind of set my hands and grab in there. That's where I want my tape to go. Come forward just a little bit. Okay, I'm bring the knee just a little bit. Get them into a little bit of a lotus position again. Start the tape. Come around the back. Don't pull real tight as you come around the back of the knee because that's not very comfortable back there. Get to the edge of the tendon. Pinch the tape. Keep your hand close. Spin your tape. So you're just as wide as the tendon is, and then bring it out so you get a nice long tab so it's going to stick down. Go to the other side. Same thing. Don't pull it real tight around the back. Just kind of lay it in there. Doesn't really matter what it looks like back there. Get to the edge of the tendon. Spin the tape. Nice and tight. Just as wide as the tendon. Nice long tab. Flexion, I have tension on my quad, I'm going to see the bum go up. Okay? So you just gradually relax your neck. You bend your knee. You just bend the knee. Okay, not too bad. We should get to here, most of us. And when you feel that, you should feel that nice soft, springy kind of calf hamstring give. Again, feel soft tissue approximation. If they had an injured leg, okay. If one leg was injured, what would happen is as you came through the range, you'd see the hip roll and pop. They try to avoid the stretch going on it. So that's the advice. Some of us are going to be tight. Some of us we're going to get to about here and feel like you can't go anymore. I mean, also moves a little bit. You can see your bum rock and roll a little bit, but it's not too bad. Okay? So that's the tonic. Come on down off the edge this way. Now, hamstring, the quad, see, you look at that. There's a little bit of tension on that quad, but we can easily get it at 90 and we don't see a whole lot change. Okay? But this is what we're looking for. If this is a tight hip flexor, this leg would be way up here. Okay? Kendall is the same thing, or they're lying more flat on their back. Their legs are flat on their back. Yeah. Kendall would be the same thing. You would just come in like this and take the leg, and this leg should stay there. If there's tight tension, it'll pop up. But I think they call that Thomas, that one. I call that Kendall. It doesn't really matter, because they're both basically the same position, doing the same thing, just so that one leg's staying free and one leg's not. Okay? And lean onto that leg. So now there's a little bit of tension again on that muscle. We take our tensor. Doesn't matter white side or pink side out. Doesn't matter in or out. How you roll it on makes no difference. Make sure you're clear of the knee joint. You're going to start by going once around the leg. And then you're going to get to the inside here. And now I'm going to pull up and across. And then I'm going to stop pulling as I come around there. Keep it high. Now I'm going to pull down and across at the front. Keep it low. Now I'm going to pull up and across. Now I'm going to pull down and across. And now I'm going to pull up. And now I'm going to pull down. And now I'm going to pull up. And now I'm going to pull down. And we get that little herringbone pattern. And then you would just use tape to secure this down. Today, if you want, just do something like that. You can just tuck it under. Obviously, that's not going to stay in the sporting world. Okay, but you have to secure that on. If any of you guys were watching any Wimbledon yesterday,